Hello, bonjour, année moitié. My name is Dr. Erin Pelche, and I'm a family physician with a special interest in cancer. I work for our Northeast Regional Cancer Program to be the voice for First Nation, Métis, Inuit, and urban Indigenous peoples. I've probably been to your community or have spoken to some of your health center staff since I started this work in September of 2019. I've heard from many people about what's important to them, and today in this short video I want to talk to you about what is important to know about screening for breast cancer. I've made these videos on different topics that you asked to hear about, and I hope you find them helpful. Be sure to look for the rest of my videos about what is cancer, screening for colorectal, lung, and cervical cancer. I've also included how to get more information at the end of every video. Thank you. Merci. Miigwech. What is breast cancer? Breast cancer happens when the cells in your breasts grow more quickly and differently than other cells. This can make a lump or tumor, but it can also cause changes in your breast that you can't see or feel. Breast cancer is the most common cancer in women in Canada. 8 out of every 10 breast cancers are found in women who are over 50 years old. And what concerns me is that the research has shown that First Nations women are more likely than non-Indigenous women to be diagnosed with breast cancer at a later stage. The 2 biggest risk factors for getting breast cancer are being a woman and increasing age. This means that all women are at risk, especially once you are over 50. Screening is the best thing you can do to find breast cancer early, when it's less likely to have spread and easiest to treat. If you are 50 years old or older, you should have a screening test called a mammogram, at least every 2 years. A small number of women may be at higher risk because of their family history and may have had a special kind of genetic testing done. If you have a lot of close family members who have had breast cancer, especially at a younger age, then talk to your healthcare provider because screening may be different for you. Breast cancer screening in Ontario is done by the Ontario Breast Screening Program. You can make your own appointment to the program. You don't need a referral. If you need travel to be arranged for you, then a referral may be needed. Ask your healthcare provider. So, you may be wondering, how does a mammogram check for breast cancer? A mammogram is a test that uses a special X-ray machine to make a picture of your breast. A plastic plate will slowly flatten your breast and hold it in place for a few seconds while a picture is taken. You will feel some pressure on your breast, but it'll only last for a few seconds. A doctor who specializes in X-rays will look at the pictures for any changes in your breasts. Both you and your healthcare provider will get the results of the tests. If your test is normal, which means no changes were seen, you will get a letter in 2 years reminding you to have another screening. If your test is abnormal, which means changes were seen, your healthcare provider will arrange for you to have more tests done. 9 out of 10 women who need to have more tests done will not have breast cancer. Not all changes in your breast are cancer, but going for extra tests to be sure is very important. Besides going for breast screening every 2 years, something else you can do for your health is to know how your breasts normally look and feel so that you are more likely to notice any unusual changes. Some of these changes could be a lump or thickening in your breast, changes in the skin of your breast, like redness or rashes, or a change in the size or shape of your breast, like dimpled or puckered skin. A change in the shape or size of your nipple, or fluid leaking from one or both of your nipples. If you notice any changes with your breasts or have any concerns, contact your healthcare provider. Most changes are not serious, but should be checked out right away. Always remember that healthy living, like what we talked about in my first video, may lower your chance of getting breast cancer, as well as many other diseases. I hope you'll take the next step and talk to your healthcare provider about breast cancer screening. Thanks for watching. To get more information about cancer, breast cancer screening, or any other programs, you can contact me at northeastcancerscreening@hsnsudbury.ca.